if you have a need or a want and you're not able to meet that need or want, over time, your body will express it for you.
Hi, Michelle.
Hi, Juliet.
I'm so excited to be able to talk to you today about art therapy.
Good.
So you have done a range of, expertise in the field. And when it comes to eating disorders and trauma work and relationship issues, why do you think art therapy is such a good match?
Well, good. I'm glad you asked, because actually when I first started working with people with eating disorders, it was a part of a general psychiatric unit. And the people that would come in who also had eating disorders, they weren't necessarily there as their primary diagnosis, responded so powerfully to using art and image and the symbolization to discuss or to engage in what was happening for them, partly because they lacked the words to express what was happening to them symbolically. And it wasn't because they weren't educated or weren't articulate. It was because there was a disconnect between how they felt and what they were able to actually say. So the people that I worked with, oftentimes they can express themselves eloquently about a range of subjects, but when I would ask them to tap into like how they felt, there was a disconnect. This is also sometimes called Alexithymia, meaning having no words for feelings, and it comes in various degrees. You can see it a lot of times if there's been trauma or other types of ruptures earlier on in their life. And eating disorders are a symbolic disorder, meaning that people who develop eating disorders, typically it is an expression or a voice when their regular voice can't express what's going on. It's not just a matter of being stressed or experiencing a single trauma. Often it's a constellation of multiple factors that sort of come together at a particular time in somebody's life and that need to be expressed at that moment. And so it emerges as disordered eating. And there's a whole continuum of disordered eating, from not eating to overeating and a lot of behaviors in between. And there's also eating disorders that may not actually meet clinical diagnoses criteria, but still can be pretty debilitating in one's life. And so those two can be addressed through our psychotherapy interventions.
Can you speak a little bit to how you have emerged throughout the process of becoming and practicing as an art therapist?
Well, I think we're all emerging all the time. It's really about becoming conscious. And I also tell my students that I think it's really important for them to be not only active artists, but also engaged in their own therapy process. So because I think it's very difficult for somebody to take another person through a therapeutic process if they themselves don't know what that journey looks like. Mm-hmm. So I always encourage my students, new professionals, supervisees, and even fellow clinicians to do that journey themselves.
Somewhat like a variation of physician heal thyself, right? You need to be in a space in order to truly understand the work of a therapist. You need to have been through that process yourself, or that's
right.
That would
well,
make sense.
And I'm sure since you work with people with trauma issues, you understand that healing doesn't happen in a vacuum. A lot of the clients that I work with who have eating disorders, they'll come in and I'll tell them, if they could heal themselves, they would have. Most people don't come in for treatment until struggling with a disorder for at least 2 years. And so getting help to have that journey, to have that support, to heal in relationship is a part of that process. Oftentimes we feel wounded or injured by the people we're closest to. And likewise, the healing can also happen, or that transformative experiences can also happen in relationship. And I think that's really one of a big job of the therapist, is to hold that space and help nurture that healing process. Mm-hmm.